Hi, pregnant friends. Okay, we need to talk about the CDC's alert on parvovirus B19. This alert came out last week on August 13th. The United States is seeing an increase in the activity of parvovirus B19, and this is particularly important for pregnant people. We care about this virus because it can directly infect fetal red blood cells. This can cause fetal anemia. Trigger warning, we're going to talk about pregnancy loss and stillbirth. An infection prior to 20 weeks has a pregnancy loss risk of about 11%, whereas after 20 weeks, that risk drops down to less than 1%. This is a respiratory illness. It's spread with respiratory droplets. Many people have mild to no symptoms, though the symptoms that we see with some people are cough, sore throat, fever, headaches, itching, stomach upset, diarrhea, nausea, vomiting, that type of thing, and sore muscles. After those symptoms, some people will develop a rash. Kids oftentimes will have what we call a slapped cheek rash, so their cheeks will be rosy, like somebody just slapped their cheek. And then they can also develop a red kind of lace-like rash on their trunk and extremities. It's red, it just looks like a lace pattern. And adults can also have that rash, and adults oftentimes will also develop some joint pain. That's less common in kids. In terms of preventing yourself from this infection, the good news is that about 50% or so, depending on the study you look at, of pregnant people have had this infection in the past and are immune. Fortunately, for those of you who aren't immune, or if you are the one of the really unlucky ones who actually has had the infection in the past but has a reinfection, which is uncommon, but it happens, the people are oftentimes contagious with this before they ever have symptoms. So it's really important to have good infection prevention habits all of the time, not just when you come in contact with somebody that you think might be sick. Some of the things that you can do to prevent yourself from getting a respiratory illness like parvovirus in pregnancy is to, one, consider wearing a mask indoors when you're in groups of people, especially children, and especially during times of years when time of the year when there's an outbreak or there's an increase in the respiratory illnesses going around. You also want to have excellent hand hygiene, washing your hands thoroughly, and using hand sanitizer with greater than 60% alcohol content. Don't share food, drink, utensils, especially with small children. And then taking steps for cleaner air. This is especially important for teachers, daycare workers, and even stay-at-home moms, because those people who spend more time around kids are at higher risk of developing a parvovirus B19 infection. So having, a HEPA filter, especially one that catches those small viral particles in your classroom, in your daycare, or in your house can be a really important measure to take. Now, if you're worried that you have been exposed or you're worried that you may have a parvovirus infection, let your OB provider know right away. We will typically order some blood tests to check for antibodies. Sometimes we'll even order more sensitive testing like a PCR test to look to see if you have an active infection. Even if those initial antibody results are negative, we will oftentimes wait 4 weeks and test again because some people just take longer to make the antibodies. And we want to make sure we know if you have a parvovirus infection or had a parvovirus infection. If the infection is confirmed or highly suspected, we will look for signs of fetal anemia. We typically do that with ultrasound, and we start those ultrasounds as early as 18 weeks. In some cases, we're doing those ultrasounds weekly to look for those signs of fetal anemia, and we're continuing them for oftentimes at least 8 weeks after the infection, sometimes longer, if there's something that we're monitoring and we have a reason to be concerned. Now, mild to moderate fetal anemia usually resolves on its own. In the case of severe fetal anemia, you may be a candidate for treatment with a fetal blood transfusion. So that's when we actually do a transfusion when baby's still in the uterus. And that is something that you would be referred to a specialist for, and oftentimes we're sending people to outside hospitals and outside medical centers for that very specialized medical care. Okay. I know I said a lot of things that are scary, but remember, only about 3 to 4% of people will have a parvovirus infection in pregnancy. Most of those cases are uncomplicated, but because in some situations this is associated with increased risk of pregnancy loss and stillbirth, we really want to do our due diligence and try to prevent respiratory illnesses as much as possible in pregnancy. I hope this helped.